Good afternoon, and thanks for joining us for this week's Live in Motion event. Today we're at the Riverside Outpatient Therapy Center located at the Gardens in Newport News, and we're joined by Lisa Krasa, a speech language pathologist. Lisa's topic for today is support for living with Parkinson's disease. Just remind you, if you have any questions during the presentation, please ask them in the comments section, and Lisa will answer them at the end of the presentation. So, good afternoon, Lisa, and you may begin.
Good afternoon. I'm Lisa Krasa. I'm a speech language pathologist working at the Gardens at Warwick Forrest in Newport News, Virginia. And I'm going to be introducing you today to the Lee Silverman voice treatment protocol, both the loud and the big programs. Let's get started. So, Parkinson's disease is a progressive neurological disorder that affects the brain. It causes tremors and rigidity of gait and balance issues, as well as decreasing speech and clarity and vocal intensity. So it makes a dramatic impact on the speech and communication effectiveness of people who are afflicted with this disease. As a disease progresses, it causes tremors and rigidity. It can lead to falls, decreased ability to talk clearly, and it can impact the overall quality of life. And Parkinson's Foundation research tells us that currently there are 930,000 people in the United States living with Parkinson's disease. And they project that that number is only going to increase to approximately 1.2 million by the year 2030. But fortunately, the Lee Silverman voice treatment program is available to you. It is research and evidence-based. It shows improvements in motor function and articulation, and it has wonderful outcomes. I've been very fortunate to work with many patients and seen the big program in action as well. So what is the Lee Silverman voice treatment? It is targeting specifically patients with Parkinson's disease. It was developed in 1987 with funding and support from the National Institute of Deafness and other communicative disorders. It focuses on increased communicative effectiveness. The BIG program was developed more recently than LOUD. It uses the same principles that apply to the movement issues. It specifically looks at the amplitude of movement, speed of movement, balance to impact the overall quality of life. It decreased risks of falls, which is extremely important with this population. So a deeper look at LOUD. The published research and effectiveness of LOUD supports improvements in the vocal loudness, the quality of the speech that's maintained up for 2 years after treatment. These improvements in common problem solving, articulation, increase facial expressions, and improve swallowing capacity. It decreases when a patient may have anterior leakage of liquids, as well as the transfer of liquids and solids to the front to the back of the mouth with patients with Parkinson's. LOUD stimulates the muscles of the speech mechanism through systemic exercise programs. These are very specific, and it's very important to follow these programs specifically to reach the overall goals of the LOUD program. LOUD treatment is administered by a speech language pathologist that has specialty certification in the Lsvt program and is administered over 16 sessions in a single month. So that is 4 consecutive 60-minute sessions per week. It's designed to be very intensive because it's the intensity that shows good outcomes with neuroplasticity, and it's a crucial part of the program's success. Patients are then trained to continue the program on their own for ongoing success, and support of family and friends in this endeavor is also crucial. Looking back at the BIG program, it has been shown to be successful in carryover of improved function as patients learn to move in big ways. Ideally, the BIG program would begin at diagnosis of Parkinson's and not wait until after the mobility issues have started. However, it should not start someone from starting at any point. Patients can benefit at any point in their process with Parkinson's. With the big treatment, it's performed by either a occupational or physical therapy assistant or a therapist who's been specially certified in the Lsvt program. Big is very similar to loud. They require an intense 4 consecutive 60-minute sessions per week for 4 weeks. Can be modified to adjust for the patient's specific ability. And sometimes we also offer touch ups for both Lsvt loud or big if someone has previously completed a full round and later has an exacerbation or their symptoms become worse. Big focuses on complex movements with repetitions and overly exaggerated movements. We do have a case study to talk about. So this is Bernie. Before Bernie had the Lsvt big program, he was experiencing 1 to 2 falls a month. He was needing to use a cane, and his gait velocity was 0.35 meters per second. This is about 29% of what would be expected for people of his own age group. For his endurance, he was only able to walk about 730 feet. After completion of the big program, he had no falls the following month. He was no longer needing to use a cane, which is enormous for someone who's ever used a cane, knows finding it is very challenging, let alone using it constantly. His gait velocity was 1.17 meters per second, which is a huge improvement. And the age match was 100% when compared to peers of his own age, with a significant increase to 1,200 feet. Huge improvements with the program. So if you are looking for a specialist in Hampton Roads, I recommend that you do visit Riverside online. There's a list of specialists there. We have many certified clinicians in both our outpatient and skilled nursing rehab settings. And if you're looking for a listing online, there's a link here so you can look at the lsvtglobal.com to find a therapist that's certified. I hope that this overview was helpful. And if you have any questions, I'd be more than happy to answer.
Okay, well, I've got a question for you, Lisa,
Yeah.
and let's start with this one. Can I do big and loud at the same time?
So you can do big and loud one session speech therapy and then maybe take a small little break and then do physical therapy, but they are separate programs. So if you're doing them one after the other, it works with a little break. But you do need to be doing the big program with a physical or occupational therapist, and the loud program is with a speech language pathologist. So it does require separate orders.
Great, thank you for that. And one other question here: are LSVT loud and big only for individuals with Parkinson's?
No, actually, they have shown that the research shows us that many people can benefit from Lsvt loud and big. Patients who have had strokes and other progressive neurological conditions can benefit. So, really, what you want to do is get a referral for the Lsvt, get an order from your physician to go see the clinician, and they will identify whether you are an excellent candidate for this program.
All right, and last question for today. And speaking of this program, where does Riverside offer the loud and big programs?
I believe I can research that real quick. So we have clinics in Williamsburg, Shoreview. We have them in Hayes. The Riverside Regional Medical Center and Walter Reed also offer that, and the Gardens at Warwick Forrest. We have the loud and the big programs accessible at the Gardens.
Excellent. Well, thanks again. Thank you, Lisa. And
My
thanks
pleasure.
to Riverside Outpatient Therapy here at the Gardens for hosting us today. And we want to thank you for joining us. If you missed any of today's presentation, it'll be available on the same page later in the day. Have a great day. Thank you.
Thank you.